When your child turns when your child who has a disability or special health care need becomes a legal adult on their 18th birthday, many of the services they receive will change, and the way that they help paying for those services will change too. Some of those changes are with waivers in health insurance coverage and programs, your child's primary doctor and medical team for their medical transition, your legal options for age 18 and beyond over your child's finances and healthcare decisions, your child's ability to get supplemental security income, SSI benefits, and your child's transition out of public education and career planning. Your child spends a lot of time with their doctors and therapists. You spend a lot of time on their medical care too. You talk to health insurance companies about getting things covered, and you work hard in general to make sure your child's medical teams work well for them. As your child becomes an adult, their medical care will also change. Waivers and health insurance programs. Here are some programs that your child might get in as an adult if they meet all of the rules and are approved. Supplemental security income, SSI benefits, Medicaid, Medicare. Supplemental security income, SSI benefits. Give your child a monthly income if they are not able to work or can only earn a very low amount. Your child can begin receiving SSI at 18 years old based on only their income and disability, not your family's income. Medicaid. This offers health and dental insurance for your child based on only their income starting at 18 years old, not your family's income. Medicare. Your child may be able to get Medicare when they are 18 years or older if they have been receiving SSI benefits for at least 24 months. Waivers. Waivers are another service that your child might be able to get. These programs are all based on your child's income, not the family's income. Most of these programs have a very long waiting list, known as an interest list. Even if you hope your child will never need those services, it is very important that your child be added to the interest list for any programs that are most able to meet their needs. You can always decline the services once your child moves up to the top of the list, so sign up now. There is no minimum age for getting on an interest list. Here are some programs that will end when your child becomes an adult. Children's Medicaid stops at age 18. CHIP, which is Children's Health Insurance Program, waiver stops at age 21. MDCP, which is Medically Dependent Children's Program, waiver stops at age 21. And yes, the Youth Empowerment Services waiver stops at age 19. Here are some programs that will end when your child becomes an adult. Continued. CSHCN, which is Children with Special Health Care Needs Program, that stops at age 21. However, if your child has cystic fibrosis, they can stay in the program until any age. Okay, continuing on, health insurance coverage through your employer-provided or private insurance plan. Your child can stay on the family plan until they turn 26, or much longer if they still depend on you financially and have a disability that meets the qualifications for receiving SSI. Options for health insurance: Medicaid, Medicare, private insurance, employer-provided insurance, and staying on your insurance. Medicaid. This is a healthcare program for people with low income and limited resources. In most states, children who get SSI payments qualify for Medicaid. In many states, Medicaid comes automatically with SSI eligibility. Even if your child doesn't qualify for SSI, they can get Medicaid coverage. Check with your local Social Security office for more details. Medicare. Medicare is a federal health insurance program for people age 65 or older and for people who have been getting SSI disability benefits for at least 2 years. Private insurance. The Affordable Care Act makes sure that everyone can get private health insurance despite any pre-existing conditions. Employer-provided insurance. If your child is employed, they may be able to get insurance through their employer. Staying on your insurance. Depending on your child's disability or special health care need, they can stay on your plan even when they turn 26 years old. Talk to your insurance provider to see how to keep your child on your plan. Contact information. The website is https://www.ssa.gov. The address for our local Social Security Administration is 702 East Denman. And the phone number is 1-877-407-3442. Okay, Texas Children's Health Plan. Who can qualify? Age 18 or younger, a Texas resident, a U.S. citizen, or legal permanent resident. Who can apply? Any adult who lives more than half the time with an uninsured child may apply. This includes parents, step-parents, grandparents, other relatives, legal guardians, or adult brothers or sisters. Anyone over age 19 or younger who lives on their own can apply. Programs through Texas Children's Health Plan. Finding the right health plan for your child is important. Texas Children's Health Plan is here to help. They offer coverage for children through CHIP and STAR Medicaid. Most CHIP families pay $35 per year or less to cover all of their children. Medicaid is free for children who qualify. The CHIP is Children's Health Insurance Program, STAR Medicaid, and STAR Kids. The contact information for Texas Children's Health Plan is www.texaschildrenshealthplan.org. Josie Martinez is your local contact, and the phone number is 1-800-990-8247.